Hello to all the HubLE audience. My name is Niloufar Ansari, and I'm a postdoc at Monash Institute of Pharmaceutical Sciences in Australia. I'm working on cell-targeted drug delivery systems. I'm also editor-in-chief of HubLE for Innovative Science Communication. I'm here today on behalf of HubLE to interview Michael Wheeler, who presented his work at ANZ-BMS 2021. Hi, Michael, welcome. Can you please introduce yourself to HubLE audience?
Hi, Niloufar. Yes, so Michael Wheeler. I am a postdoctoral researcher at the Australian Catholic University within the Bone Health and Fractures Research Program.
So you presented your work at ANZ-BMS. Tell us more about your work.
Yeah, so I presented a poster. It was about the association between eating disorders and risk of fracture and falling. And so the important context there is that malnutrition as a result of having an eating disorder can negatively impact the skeletal system. And there's evidence suggests that it translates to an increase in fracture risk. But most of the evidence is actually in females. So we wanted to see whether there was the same effect was present in males and females. And then in addition to negatively impacting the skeletal system, malnutrition can also affect other bodily functions. So things like impaired muscle strength and dehydration and low blood volume. And so those things can affect the risk of falling, but it's not really clear whether having an eating disorder can increase your risk of having an injurious fall without fracture. So yeah, we essentially looked at the association between eating disorders and the increase in fracture risk and in injurious falls in a large sample of men and women.
Oh, that's very interesting. So what were the key findings of your work?
Yeah, so we looked at a large sample of, so we had about 8,800 men and women, and then about 88,000 age and sex match controls, and we looked at them over a 20-year period. Essentially what we found was that there was a similar increase in fracture risk and increase in risk of injurious falls in both men and women. There were no significant sex differences, and there were no significant interaction with age as well. So yeah, that's essentially what we found.
So what do you think would be the big picture of these findings in practice?
Yeah, so I think the big picture is that it shows that that men with an eating disorder are also at an increased risk of fracture in addition to females, and in a similar way to females. And I suppose that addresses a gap in the data, but it also has practical implications for clinicians to be just as vigilant of the increase in fracture risk for male patients with an eating disorder as female patients with an eating disorder. I think also another implication for clinicians to be aware of is the increased risk of injurious falls, because that really hadn't been looked at before. So that maybe there can be, some thought around developing strategies to help prevent injurious falls in patients with an eating disorder.
That's very interesting. And this is not my fault and might not be of many audience. May I ask, what do you mean by eating disorder? Is it balance between food, nutrition, or just not eating very well?
Yeah, so they're eating disorders. There are a few, and the two that we looked at were anorexia nervosa and bulimia nervosa. So they're complex psychological disorders that affect our eating behavior.
Thank you.
So anorexia nervosa is kind of associated or characterized by distorted body image. And bulimia nervosa is characterized by patterns of binge eating and then purging, and both of these can have effects on increasing fracture risk and risk of injurious falls.
That's interesting. And you had about 8,000 patients with these disorders. I didn't know it's that common, like the eating disorders. That's interesting. So may I ask you what's next in your career?
Yeah, so what's next is that I'm currently working on a trial that's we're about to get up and running called the OsteoPrep trial. So my colleague Alison Fleur had presented a fantastic poster on the design of this trial. So anyone that's interested, I refer you to Alison's excellent poster presentation. Essentially, this trial that we're about to start is looking at the effect of probiotics on bone health in postmenopausal women. And we're looking at a range of other outcomes as well, in addition to HRPQCT and DEXA. So HRPQCT is the main outcome, but we're also interested in effects on cognitive function, cardiovascular function, immune function, because we think that this intervention will have effects beyond effects on bone. So I suppose we're interested in these other outcomes, but we've applied for some funding as well to try and measure some of these extra outcomes, and we'll be planning on applying for more funding as well, and hopefully it'll be a rich data source that we will hopefully publish lots of papers from once we're finished.
That's exciting. Wish you best of luck in your future study. And I want to thank you for taking the time and discuss your work with us today. I would also like to thank the audience for joining us today. If you're presenting your work at the musculoskeletal meeting and you want to be interviewed, feel free to reach out one of our editors or fill the form on HubLE website, huble.org, and then you can contact you and plan the interview. Thank you, Michael.
Thanks, Niloufar.
See ya.
See ya.